So we have a larger study that is a cohort longitudinal lifetime study for people with sickle cell disease, and that is called SCRIP, SCCRIP. It's referenced in the article, the background. And within that study, we follow up all of our individuals with sickle cell that come through our pediatric sickle cell clinic. And then we follow them into their adult clinics as well. But as part of that study, which makes it unique and us able to investigate some of these larger social questions, is that we collect everything within the EMR, both retrospectively and prospectively, once a person consents to the trial or the other protocol. And part of that, we have a rich data set, a clinical data set that we're able to capture. And one of my roles within the study, I'm the co-chair within the psychosocial working group. And I've been asked to geocode everyone every year when we do our data freeze. And we apply a number of free, publicly available kind of social determinant level neighborhood characteristics to our cohort. And within that, this is the first one where we actually use the USDA's food atlas. Typically, we use like the economic hardship index, the social vulnerability index, the area deprivation index, a number of other kind of American Community Survey census level data, so we can kind of get a sense as a proxy for understanding the context in which these patients are coming to the clinic, where they're coming from in their community. So Hamda and team brought up, a interesting question. They started exploring one, like the impact of access to food on acute care, healthcare utilizations, and a couple of other variables as well. And so we presented that concept, or Hamda presented that concept to our SCRIP scientific committee, and got some feedback. We have a robust committee of co-PIs and investigators from various backgrounds, and incorporated that feedback, and then explored how they might impact healthcare utilization in the context of understanding that our patients are getting this is biased, but like top-notch care at St. Jude in terms of like how the type of wraparound services that they get. And we wanted to understand why some individuals still have a very high acute healthcare utilization rate as compared to others. And we've hypothesized and talked about it anecdotally about how neighborhood is going to impact healthcare outcomes within sickle cell disease. It's natural assumption. It's found in a number of other chronic diseases, as well as just in the regular population, how a place impacts health. It's understudied in sickle cell disease, but we have the data to be able to do that. And I think we're in a unique position to really start answering questions related to that and show some of that. So this is, I think, one of the examples of us exploring that particular research question, and seeing if we can tease out, the impact of neighborhood level factors on health outcomes, in the context while we're controlling for, whether somebody's receiving hydroxyurea or other chronic disease management treatment modalities like chronic transfusion and so on. And in spite of that, are they still, if they come out of a neighborhood that has showing higher rates of deprivation or higher rates of vulnerability or lower rates of food access, to that impact those health outcomes above and beyond the treatment that they're getting?
In the general setting, a lot of the times the care is always given, or a disease or a person or a patient has always been looked into an example of what disease they're coming to, or what disease they're representing in a clinic. However, a lot of the times the environment that they're coming in is not as much of a great focus for a lot of different clinics, for a lot of different research aspects. So our study and our clinic and this bigger study SCRIP, one of the goals of our understanding this condition is to figure out how we should start looking into every single subject, not just the result of their or outcome of their condition, but also how the environment that they come in or the environment that they bring to the clinic also plays a role. So just like how Jason said, the place and the health plays a huge role. The condition also adds another aspect to how the outcome is going to look like. Essentially, what we want to do is we want people to start looking at the granularity of how every single thing that is associated to a person can ultimately determine how well they're going to live. One thing that we noticed a lot when we were doing our literature search for this particular study was that a lot of the study designs actually did not thoroughly looked into collaboration with certain experts in environmental health or other sort of social determinants of health. So you would see that even though sometimes it's not considered to be a big deal, but a lot of the times it's usually your own research design as well that determines the kind of data that you're going to collect. So bringing that collaboration, understanding a condition from expert level, from the industry, from the clinic, from the health experts who are actually living within the community itself, also plays a huge role.
Incorporating that multidisciplinary team to understand those multiple factors. I mean, we're at a interesting point in time where we can understand the genome and how genetic factors play a role, but we can also understand the macro level as well. So it creates this situation where we're really able to capture all the way from the genetic side to how the environment can impact the genetic side as well, and go all the way through and capture that whole and try to tease out, what factors are playing the biggest role.
One thing that I would just reiterate is that um, understanding that if your hospital where you're providing care, regardless of how standardized it is, or how highest level it's going to get, the patients who are coming from the same environment as Jason mentioned, they are going to go back to the same environment once they're treated for their illness. So for example, say a sickle cell patient who is coming to our clinic for acute care visit, there might be something in the environment that caused it along with their own bodily issue. But regardless of how much care you're going to give to them here in the clinic, and regardless of how standardized it is and how best it is, they're still going to go back to the same exact environment that initially might have played a role in causing that issue. So looking into that entire picture of what is the main issue is the whole point of writing papers like these. Our goal is to not just generate data and increase the knowledge that's out there, but at the same time also provide awareness that we should start addressing things in a more holistic way if we want to actually create something that's more unique and more long lasting.